Hello, welcome to another video of our YouTube channel. What if I told you that a tiny wound in your stomach could silently turn your life upside down? If you want to know more about it, be with us until the end of this video. A stomach ulcer or gastric ulcer is an open sore in your stomach lining. It's a common cause of focal stomach pain, pain that you can feel coming from a particular spot, often with a burning or annoying quality. But not all stomach ulcers cause noticeable symptoms. Stomach ulcers are common and treatable, but they can become serious if they go too long without treatment. Some ulcers bleed continuously, which can lead to significant blood loss over time. Some can continue to erode through your stomach wall until there's a hole. Sometimes a stomach ulcer is called a peptic ulcer. Stomach ulcers are one type of peptic ulcer disease. In the US, healthcare providers treat about 4 million stomach ulcers every year. Ulcers are common in our society because their main causes are also common. These include use of over-the-counter OTC pain medications and a widespread bacterial infection called H. pylori. A stomach ulcer feels like a sore spot in your stomach, which is located in your upper abdomen, between your breastbone and your belly button a little to the left. Typically, ulcer pain feels like an acid burn in your stomach, or like something is eating it. This feeling isn't an illusion. Stomach acids, enzymes, and other chemicals are eating away at the wound. Many people experience indigestion with the stomach ulcers, which means burning stomach pain together with a feeling of fullness. You might feel full shortly after you've started eating and or long after you ate. People also report acid reflux and heartburn, nausea and vomiting, bloating, belching, and gas pain. These symptoms are related to the conditions that caused your stomach ulcer. Some people don't feel their stomach ulcers at all. These are called silent ulcers. You might not experience any symptoms until you develop complications like bleeding or perforations. These symptoms might include pallor, dizziness, weakness, or faintness, black blood in your poop, a vomit that looks like a coffee grounds, sudden severe abdominal pain that doesn't go away. If you develop any of these symptoms, see a healthcare provider right away. Type 1 bleeding ulcers. Active bleeding from a stomach ulcer can be mild to severe and can affect you a little or a lot. Moderate blood loss can lead to anemia, while severe blood loss can lead to shock. Type 2 perforated ulcers. An ulcer that erodes all the way through your stomach wall is rare, but it's an emergency. Stomach acids and bacteria that leak from the hole into your abdominal cavity can cause an infection. Infection in your abdominal cavity can easily spread to your bloodstream and lead to sepsis. The two most common causes of stomach ulcers are the H. pylori bacterial infection and overuse of non-steroid anti-inflammatory drugs. These two causes together account for about 90% of the stomach ulcers in U.S. healthcare providers treat. Normal lifestyle factors like your day-to-day stress levels and what you eat and drink don't cause stomach ulcers, but they can make your symptoms worse if you have one. Anything that makes your stomach more acid can irritate the wound, including smoking, alcohol, spicy and acidic foods. Your healthcare provider will begin by asking you about your symptoms and medical history. They'll want to know if you frequently use NSAIDs or have a history of H. pylori infection. If signs point to an ulcer, they'll take a look inside your stomach to find it. Your healthcare provider will want to check for H. pylori infection, then look for the ulcer itself inside your stomach. They can do these things in a few different ways. One common method is an upper endoscopy exam, which can accomplish both at once. An upper endoscopy (EGD) test goes inside your stomach with a tiny camera on a long thin tube. The tube goes down your throat while you're under sedation. Through the tube, a healthcare provider can pass long narrow tools. Your provider can use these tools to take a tissue sample and test it for H. pylori. They can also use tools to treat a stomach ulcer on site. This is especially helpful if your provider suspects complications like bleeding. Your stomach lining will begin to heal when the cause of the ulcer goes away. If you can, make it go away without treatment. For example, if your ulcer is due to NSAID use and you stop taking NSAIDs, this might be enough for the ulcer to heal by itself. On the other hand, if you have an H. pylori infection, you'll probably need antibiotics to make it go away. Your provider can also prescribe other medications to help reduce the acid in your stomach and protect your stomach lining to promote faster healing. Thank you for being with us until the end of this video. I hope this video helps you to know more enough about stomach ulcer and symptoms of it. And on the other hand, we try to inform you about some treatments of it. If you are interested to know more about medical words, don't forget to subscribe our channel and see our other videos like this.